Hi, I'm Robert. This skills video is about oral airways. We use an oral airway to keep the airway open anytime that a patient is unconscious. The reason for this is that the tongue is very easily swallowed and it'll stop the breathing. The times when we don't use an oral airway is one, if the patient has a gag response, so they gag it up, or two, if there is facial injuries and severe bleeding and so forth around the mouth, and then we won't use an oral airway because it may be counterindicated. Okay, to use an oral airway, you need to measure how big. They come in different sizes. We have a very small one, a very large one. Okay, the method for measurement is from the corner of the mouth to the base of the ear. Okay, and she doesn't have an ear here, but I'm just going to simulate. So we want it to go about that far, and for her I'm going to take one a little bit smaller because I know it'll fit in fine. Okay, to insert, you need to open the mouth and you put it in at an angle like this, and as you go in you rotate around and push it on in. It should go down flush, but this is a CPR dummy, so it doesn't quite fit in. So that's an oral airway. Again, we won't use this if the patient has a gag response and they gag it up, and we won't use this if there's trauma in the mouth area. So the measurement method is from the corner of the mouth to the tip of the ear. Thank you. Is that okay, or should I do it again? Hi, I'm Robert, and this skills video is a quick demonstration of using nasal airways. We use nasal airways when we can't use an oral airway and we need to keep the airway open. There's a few things to remember about the nasal airways. First, they're in multiple sizes, just like oral airways. Second, the measurement method is from the edge of the nose, where it's going to go in, to the ear. So take one here. You can see here that this one will work. But you also have a secondary factor because they have different diameters, and so you need to match the diameter with what goes in. When you put an airway in, you want it to follow the natural curve of the nasal airway. So it's going to be like this. And again, you put it in and rotate it as it goes in and push it on down. Okay. Now this needs lubrication. So normally you'll have some lubricant jelly along with your airways. But if you don't, you can always take the patient's saliva and put that on to do it. Now, airways you don't want to force because there is some probability of pushing the airway through the sinus and into the brain and causing death. So be careful as you put it in that you put it in and rotate it in and it goes in smoothly.
Tell them about the angle of the opening in the airway.
There is an angle of opening on this, and you want this pointed towards the center. So we have to go into the right nostril with this airway. If you needed to do a left nostril for some reason, you would take your scissors and cut it the other direction. Thank you.